Vicki Hogarth, and this is a NewsBreak26 special report. 2 confirmed cases of the South African variant of COVID-19 were identified in New Brunswick this week in Zone 2, the St. John region. I'm joined today by Chief Medical Officer of New Brunswick, Dr. Jennifer Russell. Should New Brunswickers be concerned particularly about this new variant?
Well, Vicki, if I could stop all travel, then I would be more confident about being able to contain outbreaks. But what we're doing in Zone 4 with the UK variant outbreak there, we have a lockdown, obviously, in the Edmonton area. To prevent any further public health measures and restrictions, everybody needs to continue to follow public health advice. Keep wearing your mask, keep your physical distance, keep your hand washing. Do not go out and gather with people unnecessarily. These are the things that are going to protect us until we can get most of the province vaccinated with 1 dose at least of the vaccine. And that won't be till the end of June.
As far as the South African variant goes, it's obviously more transmissible, but is it more severe in terms of symptoms?
The variants of concern that are out there right now are circulating in the rest of Canada and the rest of the world are more contagious. They cause more severe symptoms, even in younger people in their 20s, 30s, 40s, and they cause more hospital admissions and ICU admissions and deaths.
As far as the UK variant goes, is that now, would you say, the dominant strain in New Brunswick?
I would say yes at this moment in time, but as you know, once a strain takes over, it usually takes about 3 months to replace the other strains. And I'm watching very carefully what's happening in the other provinces in Canada in terms of which strains are dominant. And the fact that people aren't quite perhaps understanding that you really do have to have the entire population vaccinated with 1 dose. And it has to be 2 weeks to 3 weeks after that first dose that you actually have a good level of protection.
Are you alarmed by the number of people in hospital right now? And what does that say about the UK variant and the symptoms, the severity?
I am really concerned, Vicki, for many different reasons. Number one, this is the worst part of the pandemic that we're going through right now in terms of the risks. We've got variants that cause more severe symptoms. A higher proportion of people need hospitalization. They're younger than we've seen in the past, and ICU admissions are happening in those younger people. And again, it's a reflection of what's happening in other provinces and what's happening globally. So we can't escape those risks. So right now, yes, our hospital system is stressed. There's no question. So Zone 4, they met their capacity and exceeded it, and now the patients have to be transferred to other zones, including Fredericton at the moment. Can we keep doing that? Yes, we can. Do we want to? No, it's not ideal. We want to keep being able to provide healthcare services for non-COVID issues. And what's happening in other provinces is they become overwhelmed. They are overwhelmed right now, and they can't provide non-COVID care. So this is a problem, and we don't want to see that happen here. So we are very fortunate in New Brunswick and in the Atlantic provinces that we've been able to keep many cases out thus far because of our travel restrictions, because of our border measures, because of great compliance and cooperation all around this province. It's been impressive. But for us to make it to the finish line where we all have our 1 dose of vaccine on board, and it's been on board for 2 to 3 weeks, that's not going to happen until the end of June. So between now and then, we are vulnerable to these variants. Even if you've had 1 dose of the vaccine, you can still get COVID. You can be asymptomatic, and you can transmit it to people who haven't been vaccinated. So everybody who's had a dose out there, I'm very happy for you. We've got 30% of the population in Zone 4 that have been vaccinated, and elsewhere in the province, I think we're up to 20%. That's great, but that still means there's a gap, and that gap won't be closed until the end of June. And so for that reason, it is very serious and very concerning right now that we all need to continue to follow the public health measures that are in place currently.
Thank you so much, Dr. Russell, for speaking with me today.
Thank you, Vicki.
That was Dr. Jennifer Russell, Chief Medical Officer of New Brunswick. For more stories and online exclusives, including live-streamed COVID-19 updates for New Brunswick, follow us on Facebook at CHCO.TV.
A news and public affairs production of CHCO-TV, New Brunswick's only source for independent community television.